Numbness, or pins and needles caused by the bike saddle, is a very common problem amongst cyclists. So if you suffer from this, you are not alone. Obviously, it is a very private and difficult thing to talk about, so cyclists will often suffer in silence. You will be pleased to know that there are a number of steps that you can take to either minimise or completely eliminate the problem. But first, let's understand what is happening to actually cause the numbness. Levels as high as 91% of cyclists reporting saddle area numbness due to their bike riding. However, the figures vary greatly from one study to the next. I've definitely experienced it, and I can attest to how disconcerting and uncomfortable it can be. A large survey-based study conducted in 2017 noted a high incidence of genital numbness, but also urethral stricture in male cyclists. Stricture is a fancy medical term meaning compressive scarring, as in to constrict. The scarring of urethral stricture can lead to infections, incomplete emptying, frequent urination, and pain with urination. It doesn't sound like fun. Erectile dysfunction is another medical condition affecting male cyclists, but the reported risk of this, again, seems to vary greatly depending on the study. One study actually reported that cyclists that rode 3 times a week, averaging at least 25 miles per session, had better sexual and urinary function than cyclists that did less than this amount. The authors of this study actually concluded that sexual and urinary health was not compromised by participation in cycling. Maybe there is an overall cardiovascular fitness effect that counteracts the local nerve and blood vessel compression effect. The first thing to know is that the area of the body we are talking about is called the perineum. Put politely, it is the space between and including your front passage and your back passage. If we look at the bones of the pelvis in that area, we can see that the standard triangular saddle shape roughly matches the shape of the bones we sit on. These sit bones are widest at the rear, where we have 2 bony bumps that are called the ischial tuberosities. Then these bones converge at the front of the body, meeting to form the pubic symphysis, which is a tough fibrous joint. There is a key pair of nerves that run along the inside of these sit bones that originate as the sacral plexus. They then unite to form the pudendal nerves. They run forward along these pelvic bones. They give off branches to supply the skin and the genital organs, and also to the nearby muscles, which allow you to choose when you wish to go to the toilet. The blood vessels, which supply the skin, organs, muscles, and these nerves, run in very close proximity. When you sit on a standard office chair or dining chair, the weight of your upper body is dispersed across a relatively large surface area, and pressure forces on the tissue and nerves are generally pretty low. A bike saddle, by comparison, is tiny and weirdly shaped, so contact point pressure can be many times higher in certain areas. Generally also, a bike saddle has minimal padding, and we tend to move around a lot less on a bike saddle, so this increases the extent of the problem. If we have a closer look at where these nerves and blood vessels actually run, you can see that there is not much body tissue between them and the saddle. During a bike ride, the direct compression reduces local blood flow to the nerves, and they can become starved of oxygen. This can lead to the warning sign of pins and needles, which is the body's way of alerting us to a potential nerve compression problem. If you don't alleviate the pressure, then the pins and needles is likely to progress to numbness. The longer this situation is left for, the longer the tingling and the numbness will take to resolve. Wander into a larger bike store and you will be confronted and potentially intimidated by a huge range of saddles of different shapes, sizes, materials, and price. How on earth do you work out which is the best one for you? In some cases, you might be able to access a test saddle, and this is really the best way to work out if the saddle agrees with you and doesn't provoke any symptoms. Or some bike shops might offer you a comfort guarantee, so if you don't like the saddle, you can return it and exchange it for a different one. So we know that there are a huge variety of saddles out there, and in broad terms, we can divide them into a few categories. The traditional saddle shape, these have the largest contact surface area, but they are often blamed for increased pressure on the sensitive nerve branches. Cutout saddles, which have a cavity running down the centre. Some studies show that cutout saddles improve blood perfusion to the perineal area for men, but they don't seem to assist women to the same degree. Although cutout saddles do seem to reduce pressure on the branches of the pudendal nerve, because they have a reduced contact surface area, they may be increasing contact stress elsewhere. Short nose saddles. Saddles are definitely trending to shorter, and the typical 27.5 centimetre length front to back is now being replaced more and more by 24 and 25 centimetre long saddles. The theory here is that if the perineum has less of a sharp, pointy saddle nose area to roll onto, there is less localised pressure up front. However, the downside of the short-nosed saddle is the widespread reporting of reduced stability while riding. 3D printed saddles. Most recently, we have the development of 3D printed saddles, which are generally much more conforming to an individual's anatomy and in some cases can be even custom fitted. They are, of course, much more expensive though. The general shape of the saddle is very important as well. If you have a wave-shaped saddle which slopes up at the rear, this can force your hips into a fixed position and limit your pelvic mobility when you want to change where your hands are on the handlebars. While this may actually be good for stability while riding, it makes life difficult when you want to take a break and sit more upright for a moment because your pelvis essentially has to roll back up the hill. Also, if you have a saddle which is rounded from side to side, i.e. has a high point in the center, then you are essentially riding on a dome. And that's going to bring the contact points of the saddle closer to those delicate nerves and blood vessels. Certain medical conditions can make you more prone to perineal numbness. Diabetes, vascular disease, and even advancing age can make you more susceptible because you will have reduced peripheral blood flow. Trauma during childbirth or pre-existing pelvic floor conditions are likely to contribute. Also, if you have very low muscle composition or very low body fat, these are factors that will reduce your own natural padding and can increase the local nerve pressure. So we now understand the problem. What can we do about it? Obviously, the first place to start is a decent bike fit. A lot of bike fitting professionals, including myself, have the opinion that it's usually not the saddle that is the problem, it's the position of the saddle and the position of the other contact points. So that being said, let's make sure that your saddle height, the fore and aft position, and the inclination is set up where you need it. I'm not going to attempt to discuss all of the important bike fit parameters here. However, I do suggest that you start with your saddle angle either at horizontal, but no more than 2 degrees nose down. However, if you ride in a very aggressive aero position with a lot of trunk lean, then this may warrant an increased amount of downward tilt. Remember, if you are having serious issues, then a full bike fit is a great idea. In terms of saddle type, I would normally suggest people start with a short nose saddle with a cutout, but don't be afraid to try other shapes and sizes. Generalized advice is no substitute for the real biological test. If aerodynamics are not particularly important to you, then you might consider raising your handlebars in relation to your saddle. This allows the pelvis to roll slightly back, more weight's placed on the rear of the sit bones, which is the area best equipped to deal with it, and there'll be less pressure on the front of the pelvis. Take regular breaks. During long rides, try and take more frequent breaks to relieve the pressure. Particularly make an effort to get out of the saddle as often as possible and move off the saddle at all stoppages, including traffic lights. One of the studies that I looked at showed that riding out of the saddle for 20% of your rides had a meaningful impact on reducing saddle numbness. It's probably easier to do on a hills ride than it is on a flat ride. Wear good quality padded bib shorts. These can make a big difference in comfort, and I think it's worth spending a little bit extra to get a good quality chamois short. Consider using chamois cream, particularly on multi-day rides. This helps to reduce skin irritation and friction, and if you're not comfortable on your saddle due to skin problems, then you're going to start making other small adjustments to your seated position, which might cause pressure buildups elsewhere. Physical fitness also plays a role because more fit individuals will have better blood circulation, which will help to delay the onset of any numbness. Plan your training program to include more recovery time between rides. It may be very tempting to condense your training program to rides on Friday and Saturday and Sunday because you're so busy during the week. But this schedule is going to reduce your tissue recovery compared to a program with at least one rest day between rides. Indoor rides generally have far less potential for out of the saddle time, so make a special effort to stand up for short breaks during these workouts. Alternate times riding with your hands in the drops, on the hoods, and on the tops of the handlebars. This spreads the load between different areas of your pelvic bones and perineal tissue. Improving your off-the-bike core stability, strength and mobility of the spinal and hip muscles can also help. To wrap it up, perineal numbness is a common, upsetting and misunderstood condition affecting a lot of cyclists. And the potential medical consequences can be very serious. But it's not something you just have to live with, and you certainly don't need to give up cycling. Understanding the causes of your numbness and taking the steps we discussed to minimise or prevent the problem will make your cycling much more enjoyable and healthier. Obviously, if you are experiencing persistent symptoms or if they're getting worse, make the smart choice and go and see the appropriate healthcare professional.
I like the cut of your jib.
If you like the cut of my jib, please give this video a thumbs up, subscribe, and click the notifications bell. That would greatly assist me to provide more cycling science, health, and performance content like this. Have you experienced perineal numbness from your cycling? Share your stories and your questions in the comments below. I'd really love to hear from you.